My name is not a MD doctor, I'm a PhD doctor, but I'm passionate about data. I'm passionate about how you can leverage data to improve processes, how you can do it for planning, but also how you can, leverage data to improve access to certain. So it's about leveraging data. And right now with iamsick, we're leveraging data to improve access to healthcare services. I'm going to also speak about some of the struggles that we experienced by focusing on a system-wide lens. And so, essentially, with our platform, what we've built over the past 5 years is essentially a digital health platform. It started off with looking for an opportunity, seeing a provincial website that didn't really, from my perspective, do a good job in terms of letting people know what nearby services exist, and then building our own, infrastructure for that, so that patients could easily see nearby options. And then from there, after building that initial platform, that initial website, adding on apps, and then trying to build a business behind it to make it sustainable. And so initially when we started the journey about 5.5 years ago, it was all about how do we, we're holding smartphones, we have technology. Why isn't the healthcare system tech friendly? Why can't you just load up your app and see where's the nearest doctor appropriate for you, nearest healthcare services, and the like? And so, and taking the context of any patient, regardless of what language you speak, regardless of your current abilities, regardless of where you are, whether you're in Northern Ontario, in the city, like to pull up your phone and to be able to see, so where's the nearest clinic? Where's the nearest pharmacy open right now? And so there were some challenges around why that could not exist. And so what we went through is figuring out how do we resolve that. And so the idea is like pretty much any patient, anywhere, anytime, find the nearest services that are appropriate for them when it comes to healthcare. And so some of the challenges to that. One is the fact that the healthcare system is siloed. It's siloed in terms of many different layers. It's siloed in terms of just the organizations involved. And part of that is because of design, right? You have a family doctor disconnected from the hospital, disconnected from the specialist. And the second is culture and some of the policies in place. And a lot of the culture, it's more historical. There's a lot of shifts and changes, which is great right now, but a lot of the culture has been around, owning that patient. Physicians, they own the patient can wait in the waiting room, that's okay. One of the reasons why a lot of physicians had that mentality was because they didn't want to be stuck waiting if a patient doesn't show up for their appointment. So their solution for that is, if I have a full waiting room, then I know there's another patient to see me. However, you can leverage technology to improve that. You can do patient queuing. You can leverage technology to make it more efficient for those healthcare professionals, and so the experience for that patient doesn't have to be the way it has been for a very long time. The other thing about culture, too, is around uncertainty around privacy. Uncertainty around just blanket statement, everything is private, regardless of what the actual data content is, just for security reasons and safety reasons. But when you actually look at the data fields and the structure of data, you can actually open up some of that data without actually, while still addressing those privacy concerns. And so there's been a lot of shift around training related to open data and the Open Data Directive to help inform that, which is great. And then last piece, with the system-wide perspective, is also the fact that the data itself is housed in lots of different systems. It's not integrated. It's fragmented. And so it's not accessible. So if you're building something, you cannot access a directory, or you might access something, a small piece of it, but it doesn't go into great granular detail. And I'll give you a couple examples of that. But the other thing, too, is the data is not current, right? It might get updated once a year. There's so much movement in the system. The current state of the system a year ago, or even a couple years ago, or even a few months ago, is not relevant to the system at this very moment. And so how do you tackle those challenges? And that was one of the challenges that we worked on. We're outside the system, we're a startup, we're ambitious to change the healthcare system, to improve the system. And so to give you a couple examples here, so here's our website. You can just search anywhere in Canada to find nearby healthcare services. On the left-hand side is a widget that we built. So any clinic can put this widget on their website, show, if it's a walk-in clinic, they can show live wait times using it. So in terms of data currency, to know, by the minute, what the wait time is for that clinic, that's very difficult to tackle. But if you can integrate with the clinic software, their scheduler, and know when patients are arriving and going, then you can calculate that. And a lot of the older systems will not allow integration, but there's a shift. A lot of those EMRs, EHRs, and the like are now providing APIs. Obviously, there's business partnerships and conversations to get access to that, because obviously there's private information within those EMRs, but it's becoming feasible. And so we've built that, and that is the sustainable part of our business, is the fact that right now, for a primary care clinic, a family doctor, they have multiple staff managing the phones, answering phones, booking appointments. They're concerned that patients are not going to show up for their appointments, so there are no-shows, which is a big concern. And so they're willing to pay for a service that would reduce no-shows through automated reminders, and that would also reduce the burden on the front desk staff by allowing patients to book online. And that's an extra plus, because that's a better experience for the patient, to be able to just go to a website, see when your doctor's available, book online, rather than having to call them up, get voicemail, and the back and forth around the bookings and scheduling. And so we offer a subscription-based service to clinics, to pharmacies for online appointment booking. But by offering it too and integrating with a scheduler, we can take it one step further for the walk-in clinics around wait times if they want to show that information. So when we first started 5 years ago, none of this was possible. Clinics were like, oh, I don't trust patients. I don't want to let them book appointments online. They're going to book like 10 appointments this week. So there's a lack of trust around that, and they wanted that control. But especially within the past year, there's a shift where they're recognizing the value, the constraints around their budgets, the opportunity around reduction in no-shows, and the like around that. And so that opens up opportunities around technology and data. The second thing about granularity of data is, yes, we have a directory, a list of locations, and I'm not going to mention names, but you can go to other websites from the province and do a similar search, but the type of information that you can see is different. Right now, it's a good user experience, so you can actually see, downtown Toronto, our current location. These are all the clinics, hospitals that I want to find a doctor right now. But you can take it one step further. You can be like, so where's a doctor accepting new patients? Right now, the process is you phone a 1-800 number, get placed on a list. I was on that list for 4 years before we built this. Now, like one click, and you can see on a map all the family doctors accepting patients. So it's that granularity of the data around who's accepting patients. But you can also take it one step further around languages. So where's the nearest Arabic-speaking pharmacist, doctor? What's the holiday hours for the upcoming holiday long weekend? That's data that doesn't currently exist. And we build out processes to collect data and to pretty much make it as simple as possible to collect that direct data either directly from the provider or other data sources to make it readily accessible to the patient when they're navigating the healthcare system. So going into the opportunities, sorry about that. So going to the opportunities, one big opportunity right now is open data and the Open Data Directive. I'll speak a bit more about that in the next slide, but that is changing a lot of things when it comes to the healthcare system, especially in Ontario. Just because in the past, the culture change was very slow. It was very fixed to priorities. And there's so many different priorities when it comes to the healthcare system. Everyone's being pulled in different directions, regardless of if you're working in a hospital, you're at a LIN, so the regional healthcare organization level, or any other thing. However, with the Open Data Directive, they put out a mandate, and it's like, they have to listen to this letter. And so that has resulted in a huge culture shift and the training around it, so that not just the tech people understand open data, but pretty much everyone has to understand it. And so there's a culture change. There's also a culture change amongst clinicians. They're willing to recognize the value of technology. They're willing to recognize how this fits into their workflows. And a big piece of that isn't just the technology itself, it's how it's designed. It's the people that, that focus on UX, on the design of those technologies, so it fits into the workflows. And so it's less disruptive than what they've had to deal with in the past. Because essentially their software systems that they deal with in the clinics, they're mainly built for billing. They're built like in the 90s for billing and that one job. Patient records and everything else was added on, but the core goal was get that billing code out to the province to get reimbursed, right? However, they have shifted a fair bit since then. It's still not perfect, and there's a lot of consolidation in that space. But especially with these past few years, there's been a huge focus around user experience and patient. And the shift from being a doctor-centric healthcare system to a more patient-centric one, which is prime for opportunity for disruption and like for anyone with a great idea to become part of that and to make change. Second, and the tie to that is integration. Literally up until recently, like I know some tech companies that have come up with solutions for medical offices, and there was no real integration. They basically had another piece of software running alongside it that would access the database directly and offer basically trigger reminders for appointments. So patients can receive a text message for that, or other services that add value that the EMRs didn't directly have, nor that they would allow integration for. However, there is a shift. A lot of those platforms are now allowing for integrations. It's still very early days, but I think within the next 12 months, we'll see a significant shift towards that. All of them are having like digital strategies to allow for those third-party apps and services to connect to it. And that's where like not just services like ours that show directories and where to go, what to do, and patient engagement around bookings, but it also allow for like patient record, like for you to have your own personal health record on your phone. Or for, like what I say, innovative technology, that can be anything from wearables, for your Fitbit to connect so you can send information to your doctor. Or it can be leveraging machine learning and AI. Or it can be leveraging anything else that you think is innovative in the space and trying to integrate it with the healthcare system. Like these are things that haven't been feasible until recently. And even now, it's still a bit early, but the next 5 years are going to change dramatically around that. And so going back to the open data piece, like this has helped significantly to where we're at right now. And now the other reason why I pointed out is because literally 5 years ago today, that's when the open data catalog for the province was launched. And so, and that was with like 60 or so data sets, and now there are hundreds. But more importantly, it's not just the data itself, it's the culture change. It's the training. Like I'm having conversations that I'm having now with the ministries or with the LINs or different agencies and organizations that literally a year and a half ago, those conversations wouldn't have been had. They're thinking about co-design. They're thinking about, there's more than just that silo, which is key for innovation in the healthcare system. So the silo still exists though. So when it comes to open data, at the top, that's just representing Ontario's open data database. But then down below, you have all these other agencies and organizations and institutions involved in the healthcare system that have their own data sets. And they all have different processes in terms of how they manage those data sets. But because of the Open Data Directive and the training around that, there will be a shift towards, some change in that to improve it. But still, if you want to innovate in the healthcare system, you have to basically blindly navigate all these different organizations and sort of know the difference between all these different organizations and what type of data they might have. And so I'm just going to touch briefly on this. So for example, Cancer Care Ontario. So out of these, the two icons that I think have the most rich clinical information is Cancer Care Ontario and ISIS at the bottom. ISIS, you can mainly access the data through, so ICES, sorry. You can mainly access it through like an academic type of angle in terms of how to engage that. It's more from white papers and the like. But the wealth of data in there is enormous. And leveraging that from a clinical perspective it would be very, very valuable. And you have tons of academics using it, but there's opportunity there. eHealth Ontario, Health Quality Ontario, those are other provincial bodies that look at either like infrastructure or like quality indicators. Let's see. Shared services in the LINs. Those more or less very similar. And so the way the healthcare system is in Ontario and a lot of the other provinces is that it's regionalized. And so Ontario is broken down into 14 different LINs. Each one are fairly similar. It's just defined by geography, and it helps with the management more regionally. And within the past year, it's even segmented a bit more, where each LIN is broken down as sub-LINs. So I think there are 74 sub-LINs. I could be mistaken, but it's around there. And then you have other provinces that are also broken down into LINs as well. the reason why LINs exist and some sub-LINs exist is because there are a lot of regional differences when it comes to access to healthcare services or the needs of those communities. And so it's very focused on those needs. And one of the focuses around the sub-LINs is sort of coordination of care. So it's not just your family doctor. You might need other healthcare services. You might have, so they focus on the very, very local needs. But there's a lot of change, and this isn't always static. So as I mentioned, within the past year, it went from 14 LINs to now all these sub-LINs. In Saskatchewan, they're now bringing all those different healthcare regions into one. So there's all this change and flux that could go on. And so if you want to innovate in the healthcare system, you have to be aware of what's going on and sort of have your pulse on that, finger on the pulse. Then in terms of public health, so there's public health provincially, but also municipality. Toronto Public Health, Ottawa Public Health, etc. And the data related to those more local ones are more within the municipal open data directories. And so for Toronto Public Health, you'd probably have to look at the City of Toronto directory. For Ottawa, it's the same thing. Correct me if I'm wrong, but I'm pretty sure that's the case. Health Force Ontario is related to sort of the HR of the healthcare system. So it's mainly focused on physicians, but it's all about where is their job posting for a physician. A lot of it's for rural postings, but there's data there which could be useful. And then at the bottom, I'm focusing more on the national lens, but also the municipal lens. And so there's all these different repositories that have information that can be relevant to healthcare. And so if you're interested in the space, it's best that you actually look at the different inventories. But the other thing too is dynamic. And so what you see listed right now this month could be different from what's listed in those inventories a month from now or a few months from now. And so if you're interested in the space, it's important to always keep an eye on that. So I'm just going to, let's see, I have time for questions, but essentially I'm just going to end off with my first, setting out a call to action. And the thing that I've observed when it comes to innovating in the healthcare space is how long it actually takes. I've spoken to companies that have gone from literally 10 years from when they came up with their concept to actually getting the traction that's needed for it to be in full momentum. And so with us, it's been 5 years, and just within the past year, we're starting to see a fair bit of traction around the sustainability of the business and the growth of that. And so with that long timeline, you need to design for the future, right? You can't just focus on it's important to know where the current state and what the current needs are, but you also have to reflect on where will things be a few years from now and sort of design towards that, because that's how long it might take. Where for other industries, the timelines are much, much shorter, and prepare for that too. And in terms of the dynamic nature as well, just recognize that things always change. There might be shifts in priorities. There might be even local priorities within the hospital, right, or within a certain region can always change. And so to be aware of that, and there's a lot of resources out there where you can learn more about that and just see what were the historical trends. But I guess the bigger opportunity that I see with all this, though, is with all the change that I'm talking about, the culture change, the integration, the merging of the silos and stuff like that, the bigger opportunity is what can be done with that, especially from an analytics perspective. Because if you go from data that's a year old or a couple years old to pretty much real-time data, then you can actually model and map out the healthcare system as it currently is and adjust to those needs. And that's what I personally find the most interesting, because I think 5-10 years from now is probably going to be a very different framework and infrastructure compared to what it is now.
Got time for 2 questions.
So question more so coming from user experience side. So a lot of times, or not a lot of times, but initially when you went to the website, it came more so as questions that you were asking. So where's my nearest doctor? Who's accepting new patients, things of that nature. So that seemed very much language driven, or word-driven, whatever you want to call that, rather than interaction and clicking on filtering, because that still assumes that somebody has access to a computer, somebody has access to a phone to be able to download that. So have you considered using NLP to be able to create a bot that interacts with text messages or even Facebook platform to be able to provide that and make this even more accessible?
Oh, for sure. I thought a lot about that. And we have like a bit of an API strategy to make it even more accessible. Because like essentially, behind the scenes with this is all structured data. And how it's being processed and handled can be in a variety of different ways. And so I guess the biggest challenge that we've had up until now is that, we're a resource-strapped startup, and we have to. And at this moment, like my main focus for the past year or so has been sort of the, bringing on clients to bring in the revenue so we can grow our team and everything else. Where like there's tons of great ideas that can be achieved, and I think that's both in terms of like our platform, but also in terms of these different open data directories and resources. You can definitely build other ways that people can interact with the data and access it.
I can ask more questions if no one else. I have plenty more. Yeah, I can keep asking. Yeah, you want it?
Yeah.
Okay.
Do you want to just shout?
Yeah.
Let's see.
I guess I was wondering how there was a conversation here a couple of weeks ago about Sidewalk Labs, this Google venture, starting up the neighborhood and having this opportunity for all that being good and bad. But yeah, they also have the Sidewalk Lab. The group in New York also has a spin-off called City Block that and they spoke at the consultation last week about being interested in healthcare and coming into that domain and is that affecting how you guys are knowing that Google is here and they're interested in your space? Is that provoking interesting conversations internally or?
For sure, and that's always I guess it's the good and bad around innovation. Like the internal debate is that because. So I'm a strong proponent of open data, and I'm a strong proponent of integration of the healthcare system and everything else. But at the same time, too, by tearing down those barriers, other competitors, especially large ones, large organizations with large, deep pockets, can also offer similar services, right? And so how can we coexist amongst that? But my personal thought with all this is around partnerships. And so with Sidewalk Labs, I have a call scheduled with them about how can we coexist? Are there value adds around our platform and what we've built and done? Same thing with other organizations that other businesses might consider strong competitors, and they'd want to clash with them and fight for them. Instead, I look at those organizations as partners because everyone has strengths and weaknesses, and everyone's at different stages when it comes to innovation, and it's figuring out how that can all work together. And so that's my thought process with Sidewalk Labs and Google, and what they plan on doing is that I see it as an opportunity where, yes, we've been building what we have. We don't have as deep pockets or a lot of resources, but if they do and they see some value in terms of what we're doing now, then we can potentially work together to have a greater common good.